So today is really all about an introduction to integrative oncology. And as Vicky kindly said, I'm Dr. Nina Fuller-Shavel. I'm a precision health and integrative medicine physician, scientist and educator, and I direct Synthesis Clinic, which is based in Reading. And I'm also the CEO of the National Centre for Integrative Oncology charity as well. So I wear several different hats. I wear a clinical hat. So I'm the medical director of Synthesis Clinic. I provide integrative oncology care there alongside our whole multidisciplinary team. I'm also the CEO of the charity that specializes in supporting clinical care, education, and research in integrative oncology. And we've also created a free app that's available at the moment on Apple to be able to give you some resources around experimenting with some of the things around integrative oncology and getting high quality information. And I also advocate at a national and international level on this topic. And these are the various parts of affiliations that I have. So I'm quite multidisciplinary in my background, which is an important part of the context for this lecture. So I am a conventionally trained physician. I have degrees in medicine and natural sciences from the University of Cambridge. I also hold distinctions in the Masters in Precision Cancer Medicine and Health Research diploma from the University of Oxford. But alongside this very conventional training, I also am a band-registered nutritionist. I've trained in health coaching, herbal medicine, traditional Chinese medicine, integrative medicine, yoga, mindfulness, and other modalities. So I bring a pretty broad toolkit to my patients and also to the clinic that I run. And from my perspective, I think it's really, really important that we look at the whole person and at a broader toolkit that may include medicines, but may also include other modalities at the same time. So what is integrative oncology, which is really, really important, right? Why are we here and why are we talking about this? So really, to me, integrative oncology is a rational person-centered integration of the best of the conventional cancer care. But we know that just treating cancer doesn't treat the whole person. So we need to make sure that we provide whole person support, which would involve evidence-informed nutrition, lifestyle, psycho-emotional well-being, and complementary medicine. Because the whole point of integrative oncology is to zoom out from the focus on the tumor and to really look at the whole person. The aim is to support better quality of life, improve personal resilience, minimize the side effects of treatment, and improve clinical outcomes. So it's a really much broader look that incorporates everything that's a part of standard of care, but also other broader toolkit modalities. So it's a rational integration, which means it needs to be based on evidence. It needs to be whole person oriented and address multiple different needs that we all have as we go through and beyond cancer treatment. We are supportive of targeted and personalized medication use. It's really important for many people, but we can't always over-medicalize everything. Sometimes the answer is not always yet another polypharmacy bit, yet another pill and 20 different pills. Sometimes the answer might be reducing harm from taking too many medications through using other modalities. And usually a physician who is trained in integrative oncology and integrative medicine can guide you through that. Also, sometimes, unfortunately, integrative oncology is being popularized by people who love to put out supplement protocols out there or medication protocols on the internet, and there's 20 different things that you're supposed to be taking. Really, this is not integrative. It's not about mindless protocols. It's about the person. It's about assessing where you're at and dynamically changing your support, meeting you where you're at each particular time. So it isn't about taking 40 different things that somebody else has benefited from. And as we know, evidence-based medicine has to be everywhere. So we need to combine the best available research evidence, clinical expertise, and what you as a person with lived experience value and want out of your treatment to get the best outcome. So to me, why do I love integrative oncology? Why have I bothered coming out of a very heavily conventional setting to do it? And really, because to me, I think it offers a sense of agency and empowerment to those of us who've been impacted by cancer, and I have a personal cancer story as well, but also to healthcare professionals, because we want to be able to say there are things that we can do. Not everything's within our control. There are many things that are not within our control, but there are things that we can do to support ourselves. And we want to be seen as the whole person and not just a tumor walking around on legs. And unfortunately, sometimes in the conventional care system, this is what we can get labeled as, and we want to see the whole picture. And to me, integrative oncology does the whole of the cancer care continuum really, really well. So from cancer prevention, risk reduction, to preparation for treatment, which is called rehabilitation, to managing the side effects of ongoing treatment, to thinking about survivorship or living well with cancer. And even at the end of life, there's always things that we can do to help support better outcomes for people. So I think it's really important to think of it as a toolkit that can come in at every different point for different people and offer benefit of whole person personalized care, really. So does it work, right? That should be the first question we ask. Does it actually change anything? Well, evidence suggests that it certainly improves symptoms. So there have been a number of studies, I've only shown a couple here, but that general IO services that are led by physicians do provide significant improvement in terms of different symptoms. So it could be anxiety, depression, overall well-being. And the rates are quite impressive. So clinical response rates in terms of symptom improvement can be anything between 50 to 75%. We also have some early evidence for survival in breast and gynecological cancer in terms of physician-led programs that involve integrative oncology being associated with better survival for those particular kinds of cancer. Again, more data is needed. We definitely need more research, although unfortunately investment in integrative oncology research is much, much less. And in fact, I was in a meeting last week that the researchers said that less than 1% of healthcare research funding goes into integrative medicine. Less than 1%. Let's just sit with that. Because actually, that's why we're not making enough progress in it. If people tell me we need more evidence, I'm like, great, give me the money. I will run the trial. But unfortunately, we're really heavily underinvested. So a lot of us who are passionate about it do the research because we donate our time to be able to do so. But unfortunately, not everybody is able to do that. We also know that integrative oncology is not anything new. Okay, so if we look at the other side of the pond, in the US, it's very well established. It's integrated into really big teaching hospitals. So Memorial Sloan Kettering in New York, MD Anderson, pretty much most NCI, National Cancer Institute centers have an integrative oncology department. So it's not weird and wonderful. It's been around for a really, really long time. It's just underdeveloped in the UK. And the other thing I will mention is thinking about Europe as well. Actually, Tuscany has a whole integrative oncology program that's within their own version of the NHS, right? That is funded by the European government. A number of German centers offer integrative oncology, and that's really, really widespread. Switzerland is another area where there's a lot more integrative oncology. So we see actually on either side of the ocean, there's a number of different programs that incorporate them into leading cancer treatment and research centers. So we do need more of this in the UK, particularly because unfortunately in the UK, our cancer outcomes are at the bottom of the league, bottom third of the league for European countries, which is really something we need to be doing something about. So what can you expect if you go for an integrative oncology consultation? This is just an example of a structure from a paper that's been written by the Memorial Sloan Kettering team. And really, you should be expecting a conversation around not only the cancer diagnosis and its treatment, but also around lifestyle. What are you eating? How are you moving? Are you sleeping okay? What are your stress management patterns? Who's supporting you? Do you have a good social structure around you? If you're taking anything that's over the counter that you have in terms of herbs or supplements, as well as your medications, all of that would be reviewed, because it's really important that we look at the reasons why you might be taking something. Is it the right thing to take? Does it interact with some of your medications? And then looking at broader aims, maybe symptom control is your particular aim. And maybe then we'd be looking at specific interventions for, say, insomnia or anxiety or pain, etc. So our clinic's model is what I would describe to you as an integrative oncology setting within the UK. So we are a medical clinic and we are Care Quality Commission registered, the same as your GP or your hospital. We're under the same medical guidelines. So we're very cautious around safety and patient support. And people might self-refer to us, or because we're a private clinic, we also get referrals from private GPs and oncology partners. So, it could be a local Spire, could be a hospital in London. And everybody who contacts us gets spoken to by a clinic coordinator who understands the integrative oncology team. And then we gather your medical information like we should for every kind of medical encounter. So it might be your history, your oncology letters, your test results. And that's just to make sure anybody who sees you in the clinic has good amounts of information to understand where you're at and where you might be going and how to best support you. We have a whole variety of people who I'll talk you through, but you might be seeing a doctor, a nutrition professional, a physiotherapist, somebody who provides psycho-emotional well-being support, and there's some specialist services we provide as well. So the whole range of things that we might offer within the integrative oncology setting. Many of you might have heard the term MDT by now, multidisciplinary team meeting. So just like hospitals, we have MDT meetings. We have 3 per week. Actually, we have a women's health one, a pain care one, and integrative oncology one. And that means that actually all of the cases get discussed with the team. So your nutritionist knows what your doctor thinks and your physio knows what your herbalist thinks, as an example. So it's really, really important to have joined up care. And we also discuss any internal or external referrals. So sometimes people would really like a second opinion, and therefore we know who to send them to get that if we need to. And we discuss other things that might be useful, such as further testing for people. And the idea of the MDT review is continuous. So it means that your plan is dynamically adjusted. So we don't issue a plan that lasts forever. That's not the point. What you need during chemotherapy might be different to radiotherapy, might be different to targeted therapies or anything else you might be doing. What you might need is if you're suffering with pain would be different if you are having GI symptoms, maybe nausea or diarrhea or other bits and pieces. So we need to make sure that the plan changes with you so that you get the outcomes that you need as you go along. In terms of our care team, so you'll see we've got 3 doctors, soon to be 4. We've got a nutrition team, all of whom specialize in slightly different aspects of cancer nutrition. We've got a senior physiotherapist who does scar therapy and medical acupuncture, yoga therapy, nursing support that we provide, clinical psychology. We provide emotional and well-being and health coaching, EFT, medical herbalist support, and a number of other things really. And within all of us, we all have our own extra aspects to bring to the table. So for me, I am also a herbalist and a traditional Chinese medicine practitioner. So I will look at that as much as I look from the medical side. I will also look broader at some of the other aspects. We also have specialist services. So the Women's Health Service might get involved in survivorship setting and holistic menopause management after treatment, as an example. And integrative pain care team gets involved in pain control. So we have a consultant in pain and musculoskeletal medicine and our emergency medicine consultant who help us lead the pain care team, in which I'm involved in as well. And we're at the moment in the process of opening a medical cannabis clinic extension, so providing that as a pain care option for people who might not tolerate other pain treatments. So when we receive a final integrative oncology plan, really it incorporates all of these different inputs. So what we actually provide for you is a couple of pages of important information and some additional resources. But what's gone into thinking around it is all of these different aspects of your medical care, all of your history, the current biochemistry, current symptoms, quality of life, really complex cancer information, because all of that needs to be put together and also be aligned with what you want to get out of it, with what your goals and priorities are at any particular given time. So let's talk a little bit about practically. Okay, this is kind of the framework. Okay, you say, well, that all sounds well and good, but what do I actually do, right? So I always think lifestyle medicine is a really good place to start, and doing as much or as little as you feel able to at that particular moment. It's not about ever being perfect, which I think when you take the pressure right off, because sometimes social media tells us that we have to be perfect 100% of the time and do everything all the time. That's not the reality. If 80% of the time we are good to our bodies, 20% of the time you take the pressure off and do other things that are important to us, okay? But the things that we do need to be thinking about is nutrition, physical activity, stress management and relationships, sleep, and of course, risky substances as well that will come with that. So to me, this is really, really important. And if you have to focus on the first four, most of us have been taught about harmful substances. I'm not going to talk about alcohol and smoking very much here because frankly, I think the public health message is pretty clear on those. But actually the four of nutrition, hydration, physical activity, sleep, and psycho-emotional support, I think are really, really important to pay attention to. So the World Cancer Research Fund has created some very clear guidelines that they actually provide for cancer prevention, but that are really relevant for people who might be going through treatment as well. So they're pretty simple around a whole food-based diet that limits the consumption of fast foods and ultra-processed foods. We do need to be mindful of how much red and processed meat and sugar-sweetened drinks we consume, and alcohol as well, because they are more cancer-promoting, for want of a word. So red and processed meat, people will probably be aware of, can increase the risk of colorectal cancer. It can also increase risk of breast cancer, which most people are not aware of. So it's really important that we are balancing our consumption and really heavily leaning into a whole food-based anti-inflammatory diet, which is what the recommendation is all about. And the other thing to say is sometimes you will hear, and some of you might have already heard, nutrition doesn't matter. Eat what you like. Well, actually, it's a non-evidence-based statement, okay? Because nutrition does matter. And in fact, European Society for Clinical Nutrition Metabolism very clearly states that all people with cancer should be screened for nutritional risk and should receive nutritional care plans, okay? And those should be targeted at decreasing inflammation, decreasing metabolic stress, and also supporting physical activity. So we know that things like an anti-inflammatory whole food-based diet is associated with better survival across multiple different cancers. And it's a low-risk intervention because there isn't really much by way of the downsides from that. Now, depending on the journey that somebody has gone through, maybe some people might have a stoma or some people might have significant gut side effects from their treatment. You might need a personalized care plan. And you may see a dietitian if your symptoms are really severe, or you might choose to get your support from BANT registered nutritional therapy practitioners who have additional training. So BANT has a directory and you can actually look for people who have the right tick in the box for having had additional cancer training. So, you know, the typical places where you do definitely want to go and see a dietitian is if you have any special feeding requirements, if you have chronic kidney disease, for example, if there's any time that somebody has said to you, you can't follow a general diet, there's really important things about maybe your surgery, your treatment plan that you might need to go and see somebody about. Movement is amazing. Honestly, I don't know if you've heard of the recent challenge trial, but actually, if you compare regular physical activity, which is not very much, to adjuvant, which is post-treatment chemotherapy and colorectal cancer, physical activity wins. Okay, and that's what the upside was of the challenge trial that was presented at ASCO this year, the Conventional Clinical Oncology Conference. So it really is medicine. Movement is medicine. And moving to your capacity with some additional guidance is really important. And there have been a number of different bits of research that shows that actually, if you look at physical activity and clinical outcomes, we can get risk reduction for mortality ranging up to 40 to 50%. Just huge. It's absolutely massive. So again, when you get told to go home and rest, that is not an evidence-based statement anymore. Okay, we need to be moving to our capacity with additional guidance. There was another example where they looked at breast cancer patients, for example, and they looked at them meeting their guidelines. So we'll talk about what we should be doing or aiming for over time. But if you take people who actually exercised regularly for 2 years after their breast cancer diagnosis, their recurrence risk was 55% lower, and the mortality reduction was nearly 70%. It's huge, huge, huge numbers. So this is not a trivial thing. This is a really, really important part of therapeutic strategy. And it's backed up by multiple different trials. So if you actually look at the evidence for it, it's very, very strong. And if you have advanced cancer, it's not a contraindication, okay? Even if you have things like bone metastases, or maybe somebody might have had an osteoporotic fracture, it doesn't mean we stop moving. It just means that we have to have personalized guidance and support. So it might be from a physiotherapist or a cancer exercise specialist, or maybe a yoga therapist as an example. The key thing that we don't want to do is to try and follow general guidelines if we've had any significant compromise, because actually if you go into a general yoga class, that person does not know what to do with you. They've been trained for 200 hours. They don't understand cancer. They don't understand surgery. They might not understand what you might need out of that class. A yoga therapist, by contrast, is trained for 800 to 850 hours, and they've had at least a cancer module at minimum within their training to talk to them about the cancer and its treatment. Cancer exercise specialists are level 4 PTs. So your average PT, personal trainer in a gym, is level 2, right? They receive a lot more training to be able to really personalize the exercise requirements to the person. So I think it's really, really important that if we've had extensive surgery, if we have significant musculoskeletal symptoms, if there's any time where you think, actually, I'm really physically restricted here and I need support, get advice from people who are trained to support people with cancer or after cancer. Overall, this is a kind of general public health message, but also very relevant with people who are going through cancer treatment, that we should be trying to work our way slowly towards, okay, at least 150 minutes of cardiovascular moderate intensity activity per week. And by that, it means that when we're moving, we have to increase our breathing rate, and we will be able to talk, okay, but we feel like we have to put some effort in here. So it could be swimming, brisk walking, cycling, doing the stairs, for goodness sake. Any kind of movement that gets you out of puff a bit is important. So 150 minutes, which means, really 30 minutes 5 times a week, as an example. The other thing that's really important is building strength. So 2 sessions of strength building activity is really, really important per week. And that's because it preserves our muscle mass and our bone mass. So if you've had a diagnosis of osteoporosis or osteopenia, it's really important to look after your bones. If we're going through cancer treatment, it can reduce our muscle mass. So it can deplete us of our muscle over time. High-dose steroids do the same thing. So if you've ever been on high-dose steroids, you tend to find that over time, getting up and down the stairs becomes trickier, okay? And that's because they actually waste the proximal muscles that we have in the body. So building strength is really important, and it doesn't have to be the gym. It can be all sorts of things, okay? It could be resistance bands at home. It could be body weight-based training, but we do need to pay attention to that. In general, minimizing sedentary time is important. So we're currently sitting down, but I will be moving later, ideally with my dog. So all of those things are important, that we're not constantly sitting for hours and hours on end. And then this says for older adults, to be honest, I think we all need to work on our balance, full stop. I think balance is an amazing thing. And a lot of cancer treatments affect balance, actually. So things like Tai Chi, yoga, dance, all of the things that help us work on our balance are actually really, really important as well. So I think of this as a 3-legged stool, for want of a word, okay? So we need to do something aerobic, something gets us out of puff. The second leg is strength, and the third leg is balance and flexibility. And I will mention flexibility here. It's not on the guidelines, but it is important that we do stretch and we keep ourselves flexible. So if we have a 3-legged stool, we can sit very nice and firmly on that, and we're nice and strong. But if one leg is missing, we tend to become a little bit more wobbly. And that's the case of any well-rounded physical activity. Now, some people might dislike one leg of that particular stool significantly. And it's about finding something you do enjoy part of it. You hate the gym, do something else. You hate yoga, do Pilates. So it might be something that you, hate running, you might like cycling. So finding something that you enjoy is the most important bit, because it needs to be something that you can regularly commit to. And actually, movement is supposed to be not a punishment, but something that we actually learn to trust our bodies through again, which is important. We need to feel capable. Our bodies are capable. Our bodies are strong. We can do things. And I think relearning that through gradual increase in movement is actually really important. So we're eating, we're moving, hopefully, and now we need to sleep, because after all of that exercise, we're exhausted. So it is important for us to pay attention to it. And a lot of the time we don't get asked, are you sleeping? Or how are you sleeping? And can we provide any support with that? So as a medical doctor, for me, it's important that we use medications rationally. So some of us might have received steroids as a part of our chemotherapy regime, but maybe minimizing that dosage with your doctor, talking about the fact that if you get a lot of steroid and you can't sleep for 3 days, actually, is there a way of slightly reducing my dose to help me sleep? What else can you offer me for sleep support? So melatonin, for example, is something that we use in clinic instead of the zopiclones and the zolpidem and all the addictive sleeping pill drugs, but it is a prescription-only medicine. And I would definitely not buy it online because you don't know what on earth you're taking if you buy prescription medicines online. Now, you will find if you go to Europe, for example, it's an over-the-counter supplement, and the same in the US, but in the UK, it is a medicine, and we treat it as such. The great thing is, from our perspective, apart from the more pharmacological aspects, we have many, many other tools to help us with sleep. So the Sleepio app is fantastic. It's cognitive behavioral therapy for insomnia, and it's provided completely free via Macmillan Cancer Support to anybody affected by cancer. So you can go on sleepio.com and you should be able to get access to that. And CBTI is very well evidenced for supporting sleep during and after cancer treatment. So it's one of the most evidence-based interventions you can have. Mindfulness-based therapies, Qigong, Tai Chi, acupuncture, and yoga also have some evidence of improving sleep and insomnia. And there's other modalities that might be up and coming, but we don't have quite enough evidence yet. So for acupressure, massage, and reflexology, there's promising building evidence, but they're not as strong as some of the other modalities. And paying attention to our sleep hygiene is also important. So things like, being aware of light. When we wake up in the morning, to be able to reset our circadian clock properly, we need to have morning natural light. Now, again, some of the time in December, we wake up and we won't see any natural light until maybe, 8:30 or 9 o'clock in the morning. But actually being able to just go out for 5 minutes and stick your face outside and be able to get some natural light on your face is really, really important. It helps us reset our body clocks. Conversely, at night, we are meant to have low light exposure to help our own normal melatonin sleep hormone production. So at night, really blaring lights that in your face actually reduce your capacity to be able to sleep well. It disrupts your normal circadian rhythm regulation. So being able to be up with the in terms of the light and being able to be exposed to natural light and reduce your exposure to light at night is important. Sleeping in a cooler room is also important. And then looking at other things to be able to reduce other stimulation. So darker, sleeper, quiet spaces. What's interesting about it is if we are exposed to young children, you can think about how much work is required to put a young child to bed, right? You might, even if you don't have one of your own, I'm sure you might have seen somebody put a child to bed. We bathe them and then we read them a story and then we cuddle them and they're all in a lovely warm environment and the lights are turned down low and maybe we'll play them some sleep music. But it's interesting, as adults, we just expect ourselves during really stressful situations to just go to sleep like that. Well, our nervous systems don't work like that. We do need a wind down. We do need some additional support. So treat your nervous system during high stress environments a little bit like a child. You do need to actually wind it down for you to be able to have a good night's sleep. So this is just something that I always encourage thinking about. What does your hour before bed look like? Is it conducive to sleep, or are you doom scrolling on the Instagram or doing other bits and pieces? So I generally say avoid social media and news in the evening because they tend to wake people up, full stop. But generally looking at your routine, a morning and nighttime routine is important. Movement really helps as well. So I'm a massive advocate for movement, but it does improve your sleep quality if you have moved, as long as you don't do a very high intensity training right before bed. So that tends to disrupt sleep, but otherwise it's a really, really good idea. Psychoemotional wellbeing support. I always talk to healthcare professionals about screening for PTSD because actually trauma doesn't just happen at the front lines of first responders or wars. It very much is present and is a feature of cancer in its treatment. And it requires a very different therapeutic approach, okay? It won't respond to just talking therapy. So if you do have PTSD or traumatic symptoms, talking about it won't actually help. You do need other interventions to support that. In more general terms, if you're thinking about more things like anxiety and depression, I will show you some of the guidelines around it, but mindfulness-based interventions have a really strong evidence base in supporting those. And sometimes people are not always ready for mindfulness intervention. So if you're in acute fight or flight trauma response, sometimes actually other things are needed first before you can do mindfulness. But actually, if you're more on the low end of the spectrum and then you have a mild or moderate anxiety or depression, then it's a really, really good thing to start engaging with. And there are lots of different programs available. A number of cancer centers run them, and there are programs available online for that as well. So I'm going to talk to you about guidelines. So people will talk to me about saying integrative oncology is not evidence-based. We actually have guidelines that have been joint guidelines with conventional oncology in the US, and we have 3 and soon to be 4 guidelines for symptom management. So for pain, for example, there's different messages of the things we can do for pain. So for general pain, musculoskeletal pain, for example, acupuncture, yoga is really, really important. They have the highest level of evidence. Reflexology, massage, and guided imagery can help as well, but have a slightly lower level of evidence. If you have neuropathy, so things like platinum drugs or taxane-based drugs can cause numbness, tingling, neuropathic type symptoms, that becomes really important in understanding that when you have that, you require a different level of intervention. So usually here, acupuncture can be really, really useful. And for those who maybe don't like acupuncture and don't want to explore that, reflexology can be useful as well. But the highest level of evidence is for acupuncture at the moment. Aromatase inhibitors, so if some of you might be on aromatase inhibitors for postmenopausal breast cancer, they can cause a lot of joint pain. And acupuncture is the most evidence-based intervention alongside movement as well. So movement is important, so moving your joints, but acupuncture as well. And then yoga has some benefit as well, but at a lower level of evidence. So those two things may be useful to try if you have joint pain related to things like letrozole, anastrozole, or exemestane as example of drugs. And then there's other things that we might be going through. So procedural pain is pain related to things like bone marrow biopsies or any other procedures. And here, again, acupuncture, acupressure, or hypnosis, clinical hypnosis can be very, very useful. And more in the symptom control settings within palliative care, then we talk about music therapy and massage as well. So there's a number of different things that we can try that can spare us the pharmacological management of pain. So it doesn't mean don't use pain medications. That's really important for us to use that. But alongside it, we can also use other strategies. For anxiety and depression, again, we have another guideline, and they have all been published in scientific journals. So you can show your oncologist these guidelines because they've been published in the Journal of Clinical Oncology, which is one of the top oncology journals. So for anxiety, they've split the different recommendations between active treatment and then post-treatment, which could be survivorship or could be later stages of cancer. But mindfulness-based interventions, which is mindfulness-based stress reduction, MBSR, MBCT, mindfulness-based cognitive therapy, or MBCR, mindfulness-based cancer recovery, are all really important. So they have the strongest level of evidence, and they should be accessible to many people because a lot of the charities run those. Yoga, you can see, comes up all across the way within anxiety and depression, with the highest level of evidence for breast cancer and lower level of evidence in other cancers. And then there might be other things we can do. So for anxiety during active treatment, clinical hypnosis, relaxation therapies, music therapy, and reflexology could be useful. And anxiety around procedures can be managed with things like lavender essential oil. So again, things that are calming in the moment, really. When we think about post-treatment, then again, yoga comes up, but also acupuncture, tai chi, and reflexology. And for depression, the recommendations are a bit different. So mindfulness-based interventions in yoga come up first as well. But we're also looking at things like Tai Chi and Qigong in the post-treatment setting, and relaxation music and reflexology during active treatment as well. So again, depending on where you feel you sit, you might say, okay, you know what, actually, maybe I have both anxiety and depression. I'm undergoing active cancer treatment. Well, okay, mindfulness is an option, yoga is an option, relaxation therapy is an option, because they're all common to all of those things. So having those resources is really good because you can kind of think about which options you might want to try, because it isn't about doing one size fits all. It may be that one intervention here will never be an option for you. You don't have access to it or you don't like it. But having a menu to choose from is important so that you can provide yourself with some support that is evidence-based within that setting. Fatigue, very, very common, as we know. And again, there's been a guideline on fatigue during active treatment, after active treatment, and post-treatment is really all around much more later stage palliative care settings. So if we're looking at active treatment in particular, and after active treatment, yes, my favorite medicine, movement. So cancer and chemo-related fatigue is the one bit of fatigue that does not improve with rest. Okay, you can rest, but the problem is if we over-rest and don't move enough, it actually worsens cancer-related fatigue. And that's because a lot of it is to do with mitochondria, energy factories in our cells, and mitochondria love exercise. Okay, that's actually a tonic for the mitochondria, for want of a word. But also exercise releases what we call myokines, little signaling molecules that go all the way around your body, and they have multiple different effects on how your body functions and how effective it is. So exercise is the top for fatigue, and so is cognitive behavioral therapy. And that's with or without clinical hypnosis, which can be useful as well. Mindfulness comes up again. So again, we talked about MBSR, MBCT, etc. And then during active treatment, they've also found Tai Chi or Qigong helpful, psychoeducation around managing your load, which is important, and American ginseng. Now, again, if you are trying herbal medicine, you should definitely be under a herbalist or an integrative physician. This isn't a DIY thing because they can interact with medications. For after active treatment in the survivorship setting, you might be looking at yoga, acupressure, and moxibustion to help you with fatigue after treatment. And I still find it amazing how much we don't warn people that actually you can really hit a wall after you finish treatment. A lot of the time when we go through treatment, it's like fight or flight, right? You're kind of going, oh, let's just get through this. And then treatment finishes and somehow people expect you to be magically fine. Click your fingers. Oh, last 6 months, 9 months, 12 months, never happened. And that's just not true. And actually, a lot of my patients, I talk to them about the fact that that's sometimes the most vulnerable point for people is when they finish treatment, a lot of the support has been withdrawn and everybody else expects you to be fine. And you're not fine. And actually, you might not be fine for several months afterwards, and you do require support, which is really important. So I think a lot of education needs to be done for the general public, the employers, and a number of other people in terms of how long it takes to actually recover from treatment. So you say to me, okay, integrative oncology is an interesting idea. I'd like to try it. How do I build my support team? What do I need to know? And I think it's really important to ask yourself some questions in terms of what would you like to have support with? So maybe it's pain, maybe you want to explore acupuncture. This is a profession might be able to help. Is there a budget for this, or is there free access or availability in your area through different charities or maybe a cancer center? When you're evaluating somebody you want to engage with, it's really important to vet them. You are interviewing them for a very important job of supporting you. So you really need to dig deeply into whether they're the right person for you. So do they have a clear website or social media? Is it professionally written? Is it balanced, or does it do a lot of medical bashing? Is there a clear scope of practice? Are they registered with the right professional body? Have they done any cancer-specific study? If you go to see a fertility acupuncturist, I'm sure they'll be lovely, but unless they've done additional cancer training, they might not be quite the right person for you. And do they have experience in supporting you with your needs? So it maybe is asking them, have you looked after anybody with cancer? Have you got any additional training? I have a really big problem with my neuropathy. Have you treated anybody with neuropathy, as an example? And the other thing that I'd like us to think about is whenever we work with people who are not maybe within the NHS or conventional care, whether you do NHS or private, it's important that everybody works collaboratively, okay? So we do want the team to have mutual respect and understanding of who does what, and there needs to be some communication there. So if your nutritionist tells you to hide stuff from your oncologist, it's probably not a good idea, okay? Because they do need to be, I know, well, Vicky's doing the wincing thing, and unfortunately, it does happen. People say, don't tell your oncologist you're doing X, Y, and Z. It doesn't mean you need to disclose everything, but what you need to do is there needs to be a safety check, and I think that's really, really important. Now, again, nobody should be contacting your treatment team without your consent. And sometimes you say, you know what, nobody's going to listen anyway, and I don't want them to be contacted. But then the practitioner has to reassure you they're keeping you as safe and as well as possible. They're doing all the interaction checks. They have copies of your test results. They're keeping an eye on everything. So it's really important that we keep things safe and effective. So red flags, if you are being sent to see somebody, but there's no clear scope of practice, you don't know what their role is. They're retired or ex-nurse. Well, that's lovely, but what do you do now, okay? What is your scope of practice? Who regulates you? Who looks after you? Who provides professional guidelines or ethical behavior guidelines? Researchers is something that I encounter out there. And I'm like, well, it's lovely that you're a researcher, but what is your scope of practice? What have you been trained to do? And what are you insured and registered to do, which is important. If there's no cancer-specific training or no professional bodies, to me, it's a big red flag. If it's big, bold claims without evidence, okay, that's a big red flag to me as well. If it sounds too good to be true, it probably is. From that perspective. So just put on your BS radar, everybody, okay? Because it's really important, because there will be people out there, and I pull them up on social media all the time, unfortunately, who will want to try and exploit the vulnerability you have when you're trying to help yourself. And they will try and make billboard claims from, not necessarily from a bad place, but just because they fervently believe in something. That's lovely. But where is the evidence? How do I keep myself safe? Is this the right thing for me? Or is it just based on your personal experience, not relevant to me at all? And I think it's really important to have a balanced conversation. And if there's no concern for safety, so if you give the person all of your medicines and they're trying to prescribe you supplements and you go, would you like to know about anything about my medicines? And they say no, it's a big red flag, because they should be doing interaction checks for everything that you're taking. So as I said, most therapies are very safe when they're done by a qualified practitioner and when with right insurance and qualifications and everything else. But if you're on any medications, they should all be interaction checked with any supplements and with herbal medicines. It's not a reason not to use supplements or herbal medicines. We absolutely use a boatload of them in the clinic, but we use them safely. And we actually have a clinical pharmacist in the clinic as well to help us with interaction checking, keeping people safe. So it's really, really important. And as I said, just try and, whenever you see something online, just put in a filter and just to say, okay, does it sound too good to be true? What qualifies you to tell me what I should be doing, right? Are you a doctor? Are you a physiotherapist? If a physiotherapist tells you to use herbal medicine, do you think they're stepping outside the scope of practice? Yes, they are, and they probably don't know very much about it, okay? So we need to be thinking about, what are your qualifications? What are you qualified to do? Can you advise me on this? Now, if you, I don't know, if you want to ask me about something that I've never done within my professional scope of practice, I will tell you I don't know, and I will refer you to somebody who does. But it's really important that we are on guard, because we are trying to help ourselves, but we need to make sure we find the right partners to do so. Free support resources, many of you will know the cancer-specific charities and the research charities, so they're all available here. And there's some specific groups, so for example, Victoria's Promise for younger women with cancer. But there's also lots of integrative care resources. So the OnKeo app I've mentioned, it's on Apple only at the moment, and Android is coming later on. But this will actually be powered to support the National Center for Integrative Oncology. So lots of information there. And it also has guided programs. So it has a 2-week program in mindfulness, yoga programs that are done by a yoga teacher who is specialized in cancer. And she actually trains other people in yoga for cancer. There is a Qigong program, for example. So there's a number of things that you can use from there. The Anti-Cancer Lifestyle app is really good. It's a US-based app, but really good for lifestyle foundations on just trying to put your basics into place, which is really good. There's Penny Braun and Yes to Life that provide online sessions. And of course, Maggie's centers are available to some people. Again, it depends on whether the cancer center in your locality has access to it. And there's a integrative care website that's a US-based website called Cancer Choices. Now, it's a lot of information, so it can be overwhelming. So I would just put a health warning on that. So dive at your peril. More the fact that it can become, because it's pages and pages of information, can become overwhelming. But they're simplifying it. So hopefully in the next couple of months, they will make it a little bit more user-friendly. NCIO, I'm going to put in a plug for my charity. So National Center for Integrative Oncology is a new charity that's I'm the CEO for. And really, we are the first integrative oncology charity that is co-led by both oncologists, but also people with lived experience of cancer. And we are moving away from just doing cancer well-being, which is important, but we want to do really clinical integrative oncology, which means clinical support, research, and education and training. So you will, if you follow us, you will see some of the events that we are doing and what we are promoting. And we're aiming to set up adult integrative oncology, pediatric integrative oncology, and we already started the Growth and Resilience in Trauma Center, the GRIT Center, that supports really psychological resilience for people. So watch this space. And then if you have treatment team members, maybe your nurses are more open to integrative oncology, do make them aware of the OnKeo app and the NCIO and the SAO guidelines. The Society for Integrative Oncology is a global organization that encourages physicians and nurses and other practitioners to join them as members, and they can learn a lot about the guidelines and how to support their patients more holistically. Thank you for listening, and now I'll open it to questions.